Hello and welcome to On Public Square, a City of Clarksville podcast where we get to know the amazing city employees that help keep the lights on. They're our friends, our family, our neighbors, and each of them has a story to tell. Now, let's say hello. And welcome to another episode of On Public Square. We're back in the studio, and guess who's back with me after a long stint out with some various things? Jimmy is back. Hi, Jimmy.
Hello. It's great to be here. And Casey, you've been doing a great job. I've been listening, of course, and just thank you for everything you're doing to introduce the good people of the city of Clarksville to the greater community.
Of course. And speaking of introductions, we are here with two new folks who have been doing a lot of great work around the city of Clarksville, both within the city employee family and without. We have here Cara and Bill. Hey, everybody. How you doing today?
Hey, great. How are you?
Doing well. And we're here, of course, today to talk about, this is going to be releasing in September, which is, of course, Suicide Prevention Month, which is what we're here today to talk about, along with the Clarksville-Montgomery County Suicide Prevention Alliance. As always, we start with introductions. Cara, would you like to go first? Just tell us a little bit about who you are, what you do.
Yeah. I'm Cara Merriam. I am the program manager for Centerstone's crisis response team. So I manage the mobile crisis team that responds to acute mental health crises in Clarksville, Montgomery County, and the 6 surrounding. And I also sit on the Clarksville Suicide Prevention Alliance board with Bill and do a lot of suicide prevention work around town.
Wonderful. And can you tell us a little bit about Centerstone itself?
Yeah, so Centerstone is a not-for-profit mental health organization. It's the largest in Middle Tennessee currently, and we're kind of spreading out to other states as well. I have been with Centerstone for 25 years in various roles. So there's lots of different services that Centerstone provides. Outpatient mental health, case management, alcohol and drug treatment. The crisis response is through Centerstone in this region. And we're also getting ready to open up a crisis walk-in center and stabilization unit, which is coming within the next year or so.
Very cool.
Yeah.
With your job, I know you actually recently moved in. You neighbor me with your office now.
Yes.
With your job, do you get to work with patients much?
I don't do a whole lot of face-to-face with patients anymore. Mm-hmm. Supervising a team that responds to the crises. They will need me to assist or co-respond or kind of help out with that assessment process or write some paperwork. So I occasionally get to interact with our clients and patients, but it's more of a supervisory role at this point.
A little more mission control.
Yes.
Love it. And speaking of office neighbors, we have my favorite office neighbor, Bill Harpel. How you doing this morning, Bill?
Well, I'm doing very well, and I appreciate you doing this. This is not something that at least there's no cameras because I'd have broken 2 already, look across. This young lady has been a blessing, and she undersells what she does because her group work 24 hours a day, 7 days a week. Mm-hmm. And that takes a lot of rotation and a lot of patience. Patience off of that side. I was asked in 2018 to stand up a mayor's challenge for suicide prevention from really SAMHSA, which is an organization woven with the VA off of that side. And it came out of Washington. So the mayor and we decided, let's stand it up and go with it. And so we brought originally 12 people in to start off with it. And most all of them, other than me, had some tie to either private practice or public practice or health department or those type things. And we started meeting on the second floor, the second Tuesday of every month. And from that point forward, we kind of got established, and now we're sitting right at 20 off of that side. But it's probably been the richest and most rewarding time that I've spent doing things in my 45 years of working in this community.
Speaking of which, can you tell people a little bit about what your job title is and what you do? I
work for the mayor. He doesn't like for me to say that much. No, but that's what I do. And I do this. I work on sustainability. make sure cardboard's hauled off. I'm kind of not a jack of all trades, maybe a half a jack of all trades, and just get called upon. I'm housed up on the 4th floor with you and Jimmy and Cara, and it's a lot of fun. But the part that I enjoy the most is I'd never worked for the city before Kim McMillan hired me as her chief of staff.
I was about to say, I knew you served as chief of staff at one point, and you're currently, I believe your job title is military liaison, correct?
Yes. And it really has been an honor to see how government actually functions. And with almost 1,400 employees in the city, and the health benefit, all the things that this organization has to deal with, it's a fast-growing community, and it's really been fun to watch. And then when Mayor Pitts came on board, it's been just a blessing to be able to work with and beside some days with Joe Pitts.
I can definitely get behind. It's really interesting to see kind of how the sausage gets made. Just in the year and a little bit of change that I've been here, it's been interesting
it's better than sausage, I can tell you that. So I like that. But this has been a wonderful project. It's taken me a while. We got off track with COVID, and so much of everybody's focus was COVID. We kind of backed down a little bit, and it's been a little more difficult to get the train back on the track.
Sure.
I started off in a statewide group called TSPN. Misty Light got me involved with that because we were the only city in Tennessee that stood up a mayor's challenge, which boggled my mind. But you really kind of realize that when we have 35% of our population are veterans, and this program was set up for veterans through the VA and their families and their family members to come through that way. But we as a group, we'll listen, we'll do anything with anybody. We don't ask this, well, do you have any military? That's a stupid question to ask, because 35% of everybody in Clarksville is a veteran.
I think we have the highest veterans per capita of any zip code in the nation at this point, or it's pretty darn close.
It's pretty close.
Yeah. I know Andrew Kester reported on that last year.
My co-chair, who couldn't be here today. So,
which we'll get you in eventually, Andrew. Don't you worry. I know you work for the county, but we're going to get you in City Hall.
He likes coming up here. So that's good. So we just kind of got started, and we were very blessed in those days. They'd invite particular ones to come to Washington for a 3 or 4 day training. If I could keep most of them out of jail, we usually got at least 2 days of training over there and stuff. But we really got some great exposure. I was invited to come back up and speak one time to another group, and that was a lot of fun. We've been invited back once, I think, so far this year, and I'm getting ready to have somebody to come down and talk to us and stuff and see where we need to go. But we've really, it's a tough subject but I think the more, I grew up in an era where somebody might pass away and nobody ever said a word. It was hush hush. And I grew up in a funeral home, and it was never discussed. We might have known, might not have known what was up, just depending on if I helped on the call or whatever. So it's a tough one for people, but there are people that in this community that have been touched by this disease and have been very open about how it's touched them. We did some training for ministers and had Dr. Monty Burks come out of Nashville and spend some time with them. And we tried to look in places that we can go. Now, the school systems, Austin P, they have pretty robust suicide prevention organizations, because it's kind of a disease that's contagious if you're not careful with it and stuff on that side.
Well, let's back up a second. You mentioned something that I definitely wanted to talk about. Last year, we had a particular event, a breakfast event with local faith leaders who work closely with the Suicide Prevention Alliance. And I know there are many events. I wanted to kind of go over a couple that I think are sort of important that show the work you all have been doing. And that was one of them. Yes. Can you talk a little bit more about how that ended up happening and what it was?
Well, I'm tickled to talk about it, but we didn't follow up this year. We hit a glitch. Me, I'm usually the glitch in the program, but we went and Reverend Bill Graham, who is a retired chaplain from the United States Army, I think, who just turned 80, I think, the other day down at First Baptist, and we've got a young lady at Blanchfield named Laura Boyd, and she's the queen of RSVPs. So she got us a bunch, but Bill had all the email addresses of most all the ministers in Clarksville. And the mayor thought it would be nice to bring them in one place. And we brought, there's about 80 chaplains on post, and I think we had about 25 come that morning to the breakfast. And of course, what we do in the community is pretty light compared to what Fort Campbell does through their department and their mental health. And there's things for another podcast to talk about what the future looks for the veterans with some more space coming available at Blanchfield, at Bach, and also in the community.
They actually have one. I should link them in sometime, and I'll link the link to their show on this episode so that people can find it a little easier. I don't remember what it's called right now. I know that the communications department runs a small podcast, though.
Oh.
Yeah, they do. And she's got a great studio. I mean, she came in that day and did all the videoing for our broadcasting and those type things. So I need to get you out there to see what they've got some toys.
That'd be awesome. Yeah. I love my audio gear. So I'm a nerd for that kind of stuff.
I will tell you, walking in here, you are a nerd.
But that's really cool. And how many people were at that event?
We had about 200 plus on that side.
And it was preceded by, we had some folks, some kind of upper ranking military folks in town to talk about the Suicide Prevention Alliance. Yeah?
Well, yes, we did. One of the things that surprised us the most, and I've just seen the report and I couldn't make beans out of it, was that the federal government put the task force together, and we were one of 5 installations. Fort Campbell was one of 5 installations, but we got invited to go to Liberty Point and bring people in, or Outlaw Field, I guess, because they were visiting us and out there, to let these professionals at a high level with the military come in and see what we were doing and how we were doing it. And there again, it's another one of those experiences that we learn more about our people by them asking questions from their people. And it was very interesting. And I don't want to ramble on too much because I think Cara is going to speak to a couple of things that she's worked on with inside, that the city has been a huge benefactor of their efforts in this, not just for City Hall of that, but I mean for the entire city of Clarksville.
So I guess turning then over to you, Cara, Bill, you said something interesting to the effect of, this is not a subject that has always been talked about as openly as one might hope as it has been needed. To that end, maybe there aren't a lot of numbers to show like then versus now, but where do we sit like on this? I know this is a national problem, a national crisis really, but where do we sit kind of in that conversation in Clarksville?
Yeah, so I mean, I brought some kind of national numbers. The data on suicide lags behind, right? So we're in 2023, and the most recent numbers that we're getting reports on are 2021. So 2020, 2021 is what the reports are, because there's a data collection. I mean, CDC, everybody has to kind of collect all of that. And the struggle with a lot of that is because it is something that people still don't talk a lot about, right? I mean, if it's a cause of death, it may not be reported as the cause of death, right? So the numbers can be skewed or not completely accurate. So for the U.S., like I'll start nationally. Nationally, currently on average, we're looking at one person dying by suicide every 12 minutes. So I know, I mean, think of that. We've been in here for 12 minutes, right? The highest, it's the second highest, it's the second leading cause of death among 10 to 24-year-olds. So that's kind of a really population that we're targeting. And it's even higher among elderly, 85 and up.
Mm-hmm.
So we kind of look at those two. Tennessee, statewide, I don't have the numbers strictly for Montgomery County. It's just not broken down into county. But statewide in Tennessee, it is the 10th leading cause of death in Tennessee. In 2021, we lost 1,219 Tennesseans to suicide in 2021, which, I mean, was one less than we lost in 2020. So it was a decrease, right? A little one.
Right.
So in the Mid-Cumberland region, which is where we are, so Bill mentioned TSPN, which is the Tennessee Suicide Prevention Network. So a lot of our data comes from them. And the health departments and the state government. So Mid-Cumberland, Clarksville, Montgomery County is in that Mid-Cumberland region of TSPN. So in that region, they kind of do percentages. So we in the Mid-Cumberland, the rate of suicide was 18.1 per 100,000. So for 100,000 people, you're losing about 18 people to suicide in 2021.
Right.
So that's kind of where we're looking at, where we lie with the national numbers, right?
I guess, I mean, any number is too high, but I guess especially given the enormous sort of effect COVID had in 2020 and 2021 on people's just everything. Even a small decrease feels like a pretty significant win. Yeah,
a decrease is a win, right? I mean, like you were saying, one suicide is too many suicides. So every little decrease, we want to enjoy that, right? And we want to kind of look at, okay, so what are we doing, and what can we do to even lengthen that decrease and make it even less year by year?
I have heard that COVID had a massive sort of a massive negative impact.
Yeah.
Is that the case?
COVID, I mean, like Bill said, we've got lost track on everything with COVID, right? There were lots of positives with COVID. I think a lot more people had access to mental health services through telehealth and televideo and all of that. But people were isolated. They didn't have contact with friends and family. They lost jobs. They lost social networks. So it did have a really negative impact on mental health across the board. And I don't think we're seeing, I mean, my opinion, I don't think we're seeing the numbers and the impact fully of what COVID is. Because again, these are numbers from, we're seeing the reports from 2021. That's still kind of like we're on the tail end of that pandemic at that point, So I don't know that we're seeing the true numbers yet. And I don't know, we'll probably see more of that as we move forward.
And of course, Clarksville, Montgomery County is in itself an interesting community because of Fort Campbell. We have a higher number of 18 to 24-year-olds because of so many. At Fort Campbell, you may see 350, 400 a month. We greeted 167 at lunch today, passing out packets just for this week coming to Fort Campbell. Now, don't get me wrong, there's a lot going out the door from the Army through Fort Campbell, but not at the proportions that we see coming from here.
I want to ask a question about sort of the nature or the characterization, if you will, of suicide. Regretfully, I can say that I've been pretty close to two people in my life whose life ended that way. And there was never really any indication that they were at that point. Are you learning to pick up on clues? What is?
Yeah. I do one of the trainings that I provide, which I provided for Clarksville Police Department. And we started in July of 2020, so that was a fun time to start, right? Training all 300 plus Clarksville police officers in mental health first aid.
Really?
Yeah. Yeah. That was an undertaking because we had to do like 20 at a time because of COVID. You had to have them distanced in the training room. And that took, I think we finally finished up. And of course, I mean, you have new people rotating in all the time. So there are folks on the force who haven't gotten that training. But one of the things we talk about in mental health first aid is those warning signs and those clues that you might not recognize if you're not looking really closely for them. And one of the myths of suicide is that it happens without warning, right? Like
Mhm.
that's kind of one of those myths that people believe suicide is just something that you can't see coming. When in reality, there are those sometimes very, very subtle warning signs that if you can get educated and learn to pick up on, that's a really important, which is why we try to educate as many people as we can. I
Mhm.
mean,
Right.
there's lots of trainings. TSPN, I'll give their website at the end. They have lots of training opportunities. I'm trained to do mental health first aid in adults, youth, and public safety, police officers,
Mhm.
first responders, that group. We have a lot of QPR trainers, which is a much shorter training that I know the city has gone through with
Mhm.
Misty. So there are lots of classes and trainings for folks who don't have a lot of education in suicide
Right.
and mental health. So you can kind of start to recognize some of those
I
signs.
see.
I want
And I want to just say real quickly with her and her training, once the police department is going to be recognized for the training that has been done because so many officers, the first group were kind of voluntold, and before it was over with, they were thrilled. And now, how many have you done? 200?
Well, you're talking about CIT, right?
Yeah.
So mental health first aid was kind of the first step. When Chief Croc came in July, that was July 2020, right? When he came in, that was his.
Oh, yeah.
We are very, very blessed in Clarksville, Montgomery County to have leadership that is making mental health a priority.
Right.
They're focusing on what can we do? I mean, they hired Joshua to come in and be the mental health, the wellness provider.
To clarify, Joshua Forbes, just so listeners know, you can go back. He was episode 2 on Public Square.
So when Chief came in, we had actually started talking about CIT, which CIT is the Crisis Intervention Team, which is a specialized police unit. That has 40 hours of behavioral health training, mental health training, and they respond to those mental health calls that come in through 911. We had started talking about that in probably 2019, and then COVID derailed everything, right? So that was kind of the mental health first aid for all of the police officers was kind of like the step up to CIT. It was like, okay, let's do this. And then once we were able to get CIT up and running again and that training getting in, then we've trained 3 groups of CIT officers. And we have a 4th one coming up in November. We went from training, we did our first training in November of 2021 and trained, I think, 18 officers at that point. And then we did another one the next November. And then from there, Chief decided he wants to do 2 a year because the training is a week long. It's from 8 to 5, Monday through Friday. So it's a pretty intense training.
And what type of things are gone over in that training? What does that class look like?
That class is it's all mental health, right? So we bring in local professionals and local experts on the subject, right? So they have presenters from everything on autism, how to interact with somebody that might be on the autism spectrum. We've got people who come in with lived experience from combat. So we talk to veterans and talk about TBI and PTSD, how to interact with folks there. We have folks come in with alcohol and drug treatment places, and what does that co-occurring look like? The mental health plus the alcohol and drug aspect. And then at the end of the week, after we've had multiple speakers come in, we do a great one. One of their favorite days is we talk about dementia and how to interact with that geriatric. Like we said, 85 and up is the highest risk for suicide. So we bring in the Alzheimer's organization, and they have a virtual dementia tour that they set up. So you set up a room and you put on goggles and it's a whole thing, and you get to experience what somebody who has dementia might be experiencing.
Oh, wow. Yeah.
It's great. Love it.
Wow.
The officers have they have a lot of really positive things to say about that.
Well, I'm really glad. I didn't know all that was occurring, but that's really, that's a topic you hear a lot about in the national news, the need for less art. I don't want to say less enforcement, but a sort of reprioritization towards crisis intervention and that type of response. So that's really cool to hear that
One
we're
month,
working on that.
they had 55 calls for CPD that were related to mental health issues. And by the time everything was watched, only 5 people were actually taken into custody for that. And the rest of them, they were able to navigate through their issues and help them there in the home. And nothing negative happened to anybody.
That's wonderful.
And that's their real goal. And with CPD also, I think the officers kind of got a glimpse of themselves to some degree and could understand that, hey, this is nothing terrible if you can finally recognize, it's always, whew, I thought Daddy was going to really be hard on me this time. And when it gets over with, it wasn't so bad when you got through. And that's what I've loved about what she has brought to the community.
That's wonderful.
Yeah, I wonder if there's a connection, and this is just purely wondering if there's a connection of, we have a lot of veterans on our police force, and I wonder if that creates maybe a little bit more sense of empathy towards some of those issues than you might see elsewhere.
Yeah, I think that we do have a lot of veterans on CPD, and I think that it brings, again, it's that lived experience and being able to understand, especially when they're responding to those veteran calls. It does kind of bring some of that. Okay, I know where you've been, and the person in crisis responds better when you can say, you know what, like, I've been where you are.
Been there, done that.
Yeah. So I think that it does help. And, the end of CIT training, the end of the week is a role playing. So, so CIT is kind of sponsored through NAMI, which is a statewide organization, the National Alliance for Mentally Ill. So they are the ones promoting CIT and trying to get CIT units in every county in Tennessee.
Right.
So NAMI brings in some officers that have already been through CIT and have like officers from other counties, and they do role playing. So we do 2 days, a day and a half to 2 days of role playing, where the officers that are in the training can kind of walk through that and practice what they've learned. And I think part of that is just giving the officers the knowledge and kind of the comfort level to be more like self-disclosing, right? To be like, hey, like, I've been where you are, or I spent time here too. You're not alone. Like, you're not the only one who's gone through this, and kind of making them more sensitive to those sort of opportunities.
I want to cycle back to something you said a second ago. You mentioned a myth about suicide and suicide awareness and prevention. Can we talk a little bit about, because there's a lot of misinformation that goes around, a lot of mythology.
Yeah.
Do you have some top myths that we can go ahead and bust right now?
Yeah, those are not in my notes, but I can come up with some. If Mental Health First Aid goes through all of those. So talking about suicide will make somebody suicidal, right? Like, asking somebody if they're suicidal is going to give them the idea in their head that they are. Huge myth. I think that's one of the biggest barriers to people asking the question and showing concern, which in reality, if somebody's having those suicidal thoughts and is thinking that way, a lot of times they don't feel comfortable just walking up to somebody and saying that, even like your loved one, know? So, but having somebody ask directly that question kind of opens it up and makes it frees them up to say, yeah, you know what, like, I kind of have been having that thought. So that's one of the top ones. Like, you've got to learn to ask the question and ask it directly. Are you having thoughts of killing yourself? Have you been thinking about suicide? Because there are a lot of differences. Sometimes we like beat around the bush with that one, right? Oh, are you having thoughts of hurting yourself? Have you thought about harming yourself? That's a lot different than have you thought of killing yourself? That's a big myth. Somebody who has had a suicide attempt and has survived that suicide attempt will never attempt again. That's a big myth, right? What we see is we can see somebody for a suicide attempt, get them treatment, have them go, they might spend some time in a hospital, be in that time from discharge to the hospital, that next 2 weeks is one of the highest risk factors for another suicide attempt.
Mhm.
So they're most at risk during that 2 weeks after
I
discharge.
see.
Which is why when we're setting up outpatient for them after that hospitalization, we want to get them in within 7 days. Like, we need to get you in front of a therapist or a doctor, a provider within that 7 days. So that's another one. Suicide happens without warning. That's another one.
Right.
Suicide is only a certain socioeconomic class or a certain group of people, which, I mean, we know just from society is not the case.
All across the board.
Yeah. I mean, you see, millionaires and famous actors and athletes.
And you
who
say,
died by
why would they?
suicide.
What issues do they?
Yeah.
Well, we don't know what issues they
Yeah.
can have. You can have everything in the world and still have a problem.
Right.
One that I've heard that's always kind of irked me, and it's even less myth and maybe just more like a crummy way of thinking about things, is that a survival from a suicide attempt, well, it must not have been that serious.
That serious. Oh, yeah.
Or just looking for attention or whatever.
Oh, yeah.
That's always been one that irks me. But
Well, and that is. I mean, I don't know if like you said, I don't know if it's a myth or if it's just people's viewpoint of it sometimes, is they're just seeking attention. Yes, that attempt could be attention. It's a cry for help. Right. So it's not that they're doing something to like get attention and create drama. It's that cry for help. And I think a lot of people think of that with like non-suicidal self-harm.
Yeah.
So like, cutting the self-harm things that people see.
Right.
So yeah, you're trying to reframe our thought process and society's thoughts about what suicide is.
And so much of it seems to be breaking down some of that stigma, being willing to have that conversation.
Yeah.
'Cause it just seems like if one of the big steps is if people were comfortable saying, I'm having this problem, I should go address it. Seems like that would be a major step.
Oh, it is a major step. If it, we talk to the military and first responders, anytime you're in a spot of leadership, if they can see you modeling the behaviors, then they're going to feel it's okay for them, So being able to voice, like, I've been struggling, even if it's, I went to behavioral health and started seeing somebody to talk about what I'm dealing with, the people that you're leading are going to feel more comfortable doing that for themselves if they know that leadership is supportive of it.
Right.
And that's what's been nice with their CIT training. The leadership has been, they weren't maybe the first class, part of them were voluntold to go, but from that point forward, the arms went up with who wanted to be next.
Yeah.
But then they have to go.
There are certain suicide scenarios that I have personally seen where, it sort of has a ripple effect on the people around them. They spend the rest of their lives asking, what could I have done differently? Why was it my fault? Is there something I could have done? And then they spend the rest of their life. So they're tortured as well by the blame that's misplaced, but it's there. What is that part of this equation too? How do we get at that broader sort of ripple effect?
The ripple effect. Yeah.
Yeah.
There's actually a great documentary. It's on Amazon Prime, called Suicide: The Ripple Effect. And it's by Kevin Hines, who had a suicide attempt and survived. And kind of he talks to survivors of suicide and also survivors of suicide loss. So those folks who have lost people to suicide. And he does talk about some of that, the blame and the what could I have done and what did I miss.
Right.
And TSPN actually has some groups. I think right now they might still, you can get the information on the TSPN site, which I'll give y'all. But because I don't know if they're doing any in person, especially locally, but they have a specific survivors of suicide loss group. So they kind of get together folks who have experienced suicide loss to process through some of that and really kind of work on their experience and the feelings and kind of work through some of that.
Locally, are there any organizations one might seek out if that's something you've lost someone to suicide recently and you want to, maybe there's a support group or something? Is there what would you recommend locally?
Unfortunately, locally, we don't have anything right now anymore. We used to have a local suicide survivor survivor of suicide loss group. We used to have one
Mhm.
locally, and it disbanded, and we just
Mhm.
haven't got that going again.
Mhm.
So there's not NAMI, which is the National Alliance for Mentally Ill, and I'll give that organization too. They do have a family support group meeting. It's was yesterday the third or the second Wednesday of the month? The third, right?
Third.
It's the third Wednesday of the month at 6:30 at the library is where they meet.
Oh,
Mhm.
Okay.
And it's not a huge group, but we're trying to spread the word that it's there.
Mhm.
So NAMI is open. I mean, I think a lot of people that come there maybe have lost somebody from suicide or have a family member dealing with mental
Okay.
illness that they just need, they need to know that other people are going through that and get some kind of answers and feedback from them.
Mhm.
And so they're a great support group.
I know when my grandmother suffered from Alzheimer's and dementia, and especially for my grandfather, who was her primary caretaker for many years, being able to get together with other men his age who were going through the same thing,
Yeah.
I think was a big deal.
Yeah. And there is a support group specific to caregivers of folks who are suffering from Alzheimer's and other dementias too. So, and that one is through the Alzheimer's Association, I believe.
Another great group.
Elizabeth Dole.
No.
Caregivers.
What was I about to say? To that end, we've mentioned a couple groups. Do we have any more we want to mention where people might can go to seek education, training, that type of thing? One that comes to my mind is the Jason Foundation. I've run charity events for them and such, and
Right.
I think the world of the Jason Foundation. They
Yeah.
provide a lot of training for educators in
They
particular.
do. That's the program that the school system uses for their suicide prevention training for their teachers. So that's big. Another one that we're seeing come up a lot is the Trevor Project. The Trevor Project is specific to the LGBTQ community, which is also a huge. They're at a greater risk for suicide. So the Trevor Project's a really good organization to reach out to.
Wonderful.
As well.
And I will include all of these links in the episode description
Good.
so people can find these groups.
Well, I know we're getting close, but I wanted to be sure. Don't forget 988.
That's where I wanted to
This
bookend.
young lady has been as crucial in that and has a lot of fingers into that because some of those it's really exactly where they had hoped 911 would have been, but because of people carrying their phone with them everywhere they go and landing somewhere else, an area code means nothing in regards to location.
Yeah.
And then, but now 988, get a dial, it comes to a friend of mine.
Right.
Not directly to
Yeah.
me. Don't.
I think that's such an important aspect of the call 988 is that it does direct you to someone at least relatively local,
Yes.
which is such a fantastic change for that. How long has it been that way?
988 rolled out nationally July 2 years ago. So 2021, July 2021.
I remember because we started getting a lot of bumper stickers in the main office. And if you'd like one, we have some keychains and some little business cards you can keep in your wallet. Come up by City Hall, stop by the mayor's office, say hi to us, and grab one.
We better get them out.
Yeah. 988 is a huge resource. I mean, that's kind of, we used to have this really long 1-800 number that we tell people to like put in their phones and save, and now it's just so much easier.
Pound this, this,
Right.
and
Yeah.
this, pound that,
Yeah.
and that. And the little guy, there was one person that really ventured and made 911 what it was. But then I saw him last summer in Washington, and he'd done the 988 number. And I thought, golly, he was pretty old when he got started on the first one. But he was so sure they could navigate through things to get it to where it would be almost like literally dialing 0 for operator, and it'd be right in your backyard.
Right.
And that's
And with 988, you can call. There's a text option because, that 10 to 24 range, especially, they don't want to talk on the phone. I don't really want to talk on the phone if I can avoid it. Like, I'd rather you text me,
Right.
So there's a text option. There's also a chat, so they can be on a laptop or computer and do a chat with 988. They also, you can link directly to the Veterans Crisis Line, which is specific to the military population. If you call 988, you can press 1 and it sends you to the Veterans Crisis Line. So it's kind of a central hub for everything that you might kind of need in a crisis.
Right.
Which I did want to mention cover one other small thing. Of course, September, when this will be released, is Suicide Prevention Month. Is there a reason why September?
I don't know.
Do we not?
That's a really good question. I
Oh.
should have researched
No,
that.
but it's nationally. So
Yeah.
I don't know. It's since I've been doing this. It's
Well,
Because I know May is Mental Health Awareness Month. September is suicide prevention. I think October is overdose awareness. So
first person to message in with the answer gets a free shout out on the podcast sometime soon. But wonderful. And thank you two so much for coming up. This has been a great talk. Bill, we're going to have you on again to talk about Reads Across America very soon with Angie Sykes. And we'll talk about that very soon.
This has been a blessing right there.
Pointing at Carl.
I was
Exactly.
like, people can't see that. Bill.
That's okay.
It's a podcast.
Well, we're happy to have her as a neighbor up here on the 4th floor now.
Yes.
We're all a family up here on the 4th floor.
Your new building is going to go much slower than you thought.
Oh,
we
man.
put up 150 rafters and they're all down again. There's an old guy that keeps coming out here in an old black pickup truck and keeps pulling them out.
Oh, goodness.
Yeah.
But no, it was so nice to have you two. Thank you for
thank
coming
you.
up and
Well,
talking
thank
about
you.
something so important. For those listening, if you are struggling with suicidal ideation or thoughts, or just having mental health struggles in general, please reach out, call 988 and seek whatever resources you can, because you're important and we want you around. And especially as we come up, this will be coming out just before the holidays, and I know that can be a real rough time for some folks.
Yep.
So, just take care of each other and be good to each other out there.
Awesome. Yes.
Thank you.
Thank you.
Thank you. And that'll be it for this episode of On Public Square.
Awesome.
He's going to make 7 circuits out of this 1 hour.